My head! I feel sick! Please, a dark, quiet room!
Is it just a regular headache or could it be a migraine? Yes, migraines do happen in children and teens, and they're more common than many parents realize. Today, we're diving deep into what migraines look like in kids, why they happen, how to spot them early, and the real steps you can take to help. Stick around, because by the end, you'll know exactly when to call the doctor and simple ways to make life easier for your child. Let's get started. First off, headaches are super common in childhood. More than half of all kids and teens deal with at least one headache by their late teens. Most are tied to things like colds or stress, but a significant number are actually migraines. Recent studies show that around 10 to 11% of children and adolescents worldwide experience recurring migraines. That's about 1 in 10 kids. By age 10, roughly 1 in 20 children has already had at least one. And here's something interesting. Before puberty, boys and girls get them about equally. But after puberty, girls tend to have them more often. If your child has these attacks more than once in a while, you're definitely not alone, and there's a lot you can do. Coming up, the signs that make migraines different from regular headaches. So, what sets a migraine apart? In adults, migraines often hit one side of the head with intense throbbing. In children, though, the pain is more likely to affect both sides, like a squeeze across the forehead or temples. Kids often describe it as pounding or throbbing, and it can come with nausea, vomiting, or feeling super sensitive to light and noise. They might need to lie down right away. Unlike adults, kids don't always get those classic warning signs like flashing lights or vision changes. Those are less common. But parents often notice clues before the headache hits. Your child might seem extra tired, cranky, pale, or just off. And after the migraine passes, it can take a while for them to bounce back to their usual energy. These attacks can last anywhere from 30 minutes to several hours. Shorter than in adults, but still tough enough to disrupt school, play, or family time. Exciting part ahead! We don't know every cause yet, but science has uncovered some big clues about what sets them off and how to fight back! Migraines aren't caused by simple things like too much screen time or one bad day, though those can play a role. Experts now understand that migraines happen because the brain and nerves become extra sensitive and overreact to certain triggers. It's not about blood flow problems like we once thought. Instead, the nervous system gets overstimulated by everyday things. Stress from school or sports, not enough sleep, skipping meals, hunger, bright lights, loud noises, or even weather changes. And here's a key fact. Migraines often run in families. If you or a close relative gets them, your child is more likely to as well. The good news? Many triggers are things we can spot and manage. In just a moment, I'll share the Nagder One tool parents use to uncover their child's personal triggers, and it's simpler than you think.
Prevention starts with knowing your child's triggers, and the best way is a headache diary.
Every time a headache hits, jot down what happened right before, where the pain was, and how bad it felt. Any other symptoms? What helped or didn't? Over a few weeks, patterns pop up. Maybe it's missing breakfast, too little water, or extra video games. Once you see those, you can avoid them. Lifestyle basics make a huge difference too. Regular, healthy meals, no skipping. Plenty of water all day. Consistent sleep schedule, enough rest is huge. Daily exercise and fresh air, ways to handle stress, like deep breathing or fun hobbies. These habits don't just help migraines, they boost overall health and energy. And if attacks keep happening despite your best efforts, doctors have safe options to prevent them more directly. Stay tuned, we'll cover those next! When a migraine strikes, quick comfort helps a lot. Have your child rest in a dark, quiet room with a cool cloth on their forehead. That alone eases symptoms for many kids. Over-the-counter meds like ibuprofen or acetaminophen doses can help too. Ask your doctor for the right amount. But important rule, don't use them more than about 14 days a month, or it could cause rebound headaches that make things worse. For stronger relief, doctors sometimes prescribe triptans, migraine-specific medicines approved for kids as young as 6. Like rizatriptan or 12 and up others like sumatriptan or zolmitriptan. They're safe when used correctly. If migraines are frequent, severe, or cause missed school days, preventive medicines exist too. Your doctor picks the best one.
For some girls, attacks link to their period, so timed prevention can help. The key? Work with your pediatrician. They'll guide you every step.
Most migraines aren't dangerous, but some headaches need quick attention. Call your doctor right away if your child has a sudden, super severe headache. Stiff neck with fever, trouble walking, talking, or coordinating. Unusual sleepiness, confusion, or behavior changes. Vomiting that won't stop. Vision problems, or weakness. Bring your headache diary to the appointment. It helps your doctor diagnose faster and create the perfect plan.
Resources like the American Academy of Pediatrics website have even more tips. Check it out.
You've got this. With the right knowledge, most kids with migraines can feel better and get back to enjoying life. If this helped, give it a thumbs up. Subscribe for more parent guides.
And comment below. Has your child had a migraine? What worked for you?
This video is for informational and educational purposes only and is not intended as medical advice. Migraine information can vary by individual, and nothing here replaces professional medical evaluation. Always consult a pediatrician or healthcare provider for personalized advice, diagnosis, or treatment. When using any medications, follow your doctor's instructions and dosing recommendations precisely. If your child experiences severe or unusual symptoms, seek immediate medical attention.
Thanks for watching.
Take care of those little heads.